Endocarditis is really unique because that's where the blood flows through. And I like to give the analogy that's really has nothing to do with the body. But if you guys can do me a favor, do this wherever you're at, unless you're driving. Don't do this if you're driving. I want you to sit wherever you're at. If you're in a safe spot where you can close your eyes, close your eyes. Close your eyes. Close your eyes. Okay, so your eyes should be closed. I want you to imagine, use that imagination. Imagine that you are in the woods and you come across this most beautiful, pristine lake. So imagine that lake. It's like the most beautiful lake you've ever seen. Picture what it looks like. Okay, that's a perfect, beautiful lake. Now, keep your eyes shut. I want you to now imagine that lake with a whole bunch of green algae on top of the water. So much so that instead of it being this most beautiful lake you've ever seen, it's the most algae-filled lake where you literally can't see any of the water and it's just completely green on top. Keep your eyes shut. Now I want you to imagine taking your hand and dipping it into the algae-filled lake. Dip it in there. Now take your hand out of that lake. Now you can open your eyes. What's all over your hand? If you did that exercise with me, you're going to say a whole bunch of algae on my hand. So the reason I bring this into this conversation is I want you to think the infection is on the inside lining of my heart, okay? It's on that endocardium. So I got all this infection, all that green algae, infection, all lining on the inside of my endocardium. All of that stuff, right? What touches the inside lining of that? Just like my hand touched the lake water and got algae on my hand, what touches the inside of this, of the inside endocardium? What flows through there? Hopefully you're saying blood flows through there. Blood, as it's pumping through your heart, is touching all this guck, all this vegetation. They like to use that term in your book for this content, vegetation. That's why I like to also use the algae thing, because algae is a vegetation. So the blood is flowing through here, and just like the algae got on your hand, this stuff, this bacteria, these vegetations get in your bloodstream because your blood touches it. And where does the blood go when it leaves your heart? It goes to your lungs. If it's on the right side of your heart, it goes to your lungs. If it's in the left side of your heart, it goes to your body. So I've got this scum floating all up in my body now. That's why you have really specific flu-like symptoms and body aches and all sorts of weird splinter hemorrhages and you get some, I think they're called Roth spots, lots of unique things because you have these little pieces that can break off and go throughout your whole body. So if you have infection in your heart here on the endocardium, now you have it in your bloodstream, and that's also why you're going to be doing blood cultures with this specific one, because they could take a culture of your blood and say, okay, well, this is the type of bacteria it is, which is usually it's staph or strep. Usually those are the two big ones. But additionally, I like to use the algae analogy. That rhymed. Because if I have all this vegetation happening right here on my valves, on my leaflets, do you think those valves, if they have all this scum building up on them, are going to shut properly? Like if this is my valve and it's supposed to shut properly, if that's normal, and now I have all these growths on here, do you think it's going to shut properly? Probably not, because those vegetations get in the way and prevent the closure. And so you get this turbulent blood flow through that area, and hopefully you're putting some pieces together thinking, well, if the valves don't shut properly, I'm not going to hear my normal heart sounds. I might hear something unique when I auscultate. I'm not going to give it all to you. You got to do the work. Go and get in your book, get in your notes, pay attention to lecture. So if you can remember that nice little analogy of the water with the algae and dipping your hand in it and getting algae on your hand, and the vegetations and the algae kind of all goes together with your endocarditis. And notice how I made it green for you visual learners, and the algae, how it all goes together. I hope this helps. Don't just stop where we talked about it. I gave you some ideas on how you can remember the endo, the myo, and the pericarditis. That's the tip of the iceberg. But you can do it. You made it this far. I'm really proud of you guys. You're doing really great. Let me know if there's anything specific that you're struggling with. Give me an email. You can go on our D2L page and find me that way. Awesome. Thanks, guys. Bye.